Yes, HIV is very people get it over a longer period of time. They don't show any symptoms. But as time goes on, the immune system is broken down. There are people with this HIV conditions who have had cancers when they did not pay attention to the HIV disease. Initially, it's asymptomatic. You don't show any symptoms. Then it's the virus weakens the immune system over a period of time. It could be 10 years, 5 years, depending on the person's symptoms. So the later stage is the advanced stage, where the patient has this meningeal signs and symptoms. Some of them get this rashes. We call it Kaposi sarcoma, this reddish kind of rash. And then people also get it from barbering shops and salons. Yes.
So good morning, ladies and gentlemen, and today is another episode. Today we are going to talk about something very, very, very interesting, but something that is feared and not talked about enough in our society. We are going to talk about HIV and AIDS. So today we are here with Dr. Ben. He will explain to us in depth what we need to know about HIV. So Dr. Ben, good morning.
Good morning.
It's such a nice time having with you.
A pleasure.
Yes. We've been going back and forth for a while, and today we have you.
Yeah.
So, Doc, can you introduce yourself just a little bit for us?
Okay, so I'm Dr. Bernard Kusiboisin. I'm the doctor in charge of Core Medical Center.
Okay. So Doc, for your time being, what do you think is the common or the generalized definition for HIV/AIDS?
Okay, so HIV basically is one of the sexually transmitted diseases, and it's usually caused by a virus. Now, when you look at disease conditions, we have diseases that are caused by bacteria, protozoa, viruses, fungi as well. And a typical example of a viral condition is measles, there's common cold, and the rest. So HIV is also one of the commonest diseases that is also caused by a virus.
And it's sexually transmitted?
Yes, it's sexually transmitted.
Only sexually transmitted?
No, not only sexually transmitted, but sexual transmission is one of the means by which people get the disease.
All right. So now talking about virus, can you maybe my mother from the village doesn't really understand virus. What generally what is a virus?
Okay, so a virus is basically an organism that causes disease in the body system. And usually most viruses thrive more in the body system. They don't usually work better outside the environment. So they are usually in the system.
Okay, they are usually in the system.
Yes.
Okay, so now, is HIV deadly?
Yes, HIV is very deadly.
Okay. Yes. How deadly is it?
Okay, so usually when somebody gets the HIV, it starts from no symptom presentation. Okay, people get it over a longer period of time. They don't show any symptoms. But as time goes on, the immune system is broken down, and they are usually affected, or they get these opportunistic infections, which will become very severe. And there are people with these HIV conditions who have had cancers even when they did not pay attention to the HIV disease. So HIV is very deadly. You don't take much attention, or you don't get the disease and then you don't try to manage it well, the disease can make you die.
So before you get to even the management, you said opportunistic infections.
Yes.
What are opportunistic infections?
Okay, so opportunistic infections are infections that normally people get. Okay, so let's say somebody gets, like this HIV I'm talking about. There are people who get this oral thrush, candida.
Okay, candida.
Yes, from the HIV. There are people who get, there's a disease condition we call meningitis. We call it cryptococcal meningitis. So once the person gets the HIV, it affects the brain.
It affects affects the brain.
Yes, it spreads through the bloodstream. The virus moves.
Okay.
So once the virus moves, the virus gets access into the brain, and then it starts causing a lot of this confusion and headaches and all those, and like call it meningeal symptoms. All these symptoms come into play. And then we also have people who have HIV who also get rashes. There are some kind of rashes that they also get. So those are the opportunistic infections.
So all of these are opportunistic infections.
Yes.
So if I get you right, it means when it goes to your brain, can you have like maybe madness?
Yes. Yes. You have madness, you have confusion, you behave like aggressive and all those things. Yes.
And all these are the early stages of the infection.
These are the latent stage, like the later parts of a disease condition. Okay. So usually when you get a disease, it runs through stages. Okay. Initially it's asymptomatic, you don't show any symptoms. Then it's the virus weakens the immune system over a period of time. It could be 10 years, 5 years, depending on the person's system. Okay. Now, it's once it affects the immune system, it runs into a stage where it gets to a point where it gets to the latent stage. So the latent stage is the advanced stage, where the patient has this meningeal signs and symptoms, and then some of them get these rashes. We call it Kaposi sarcoma, this reddish kind of rash. Kaposi sarcoma.
Kaposi sarcoma.
Yes.
Wow.
So they're a type of rash that most people usually get. And then sometimes to most of these HIV patients also get TB, tuberculosis.
Okay.
Yes. The HIV also affects the lungs as well. And they get pneumonia too. So those are the latent stages. As the person gets it, the person didn't manage it, didn't go to hospital, the person was not on medications. When you're on the medications, they reduce the rate at which the disease progresses. So if all these things are not done, and the disease takes you into the advanced stage, where you have these meningeal signs and all this pneumonia, TBs, and all those things.
That is quite scary.
Yes.
That's quite scary. So yes, we will still be coming to the management stage. But what I want to know is, if two people get HIV at the same time, what will be the differentiating factor that one will show the latent symptoms in 5 years and another person will show it in 10 years? What is the difference? What makes one like show it faster than the other?
Okay. No, now in the body system, okay, you see, when you take two people, even twins, okay, the rate at which the immune system works might be different between the two people. Okay, there are people, let's say a couple, a man and a wife, they had sex, unprotected sex. The woman had the HIV, but through sex the man did not get, even though the woman was positive. Yes. And then it came the other way for a different couple, where the man had it, the woman got it. Because usually, when it comes to sex, most of the time the women are carriers, they are receivers. So once they receive the sperms, the rate at which they get the infection is more faster than the rate at which the men also get. So most of the time, it's the immune system that speaks. If the person has the HIV, probably was eating well and all that, in 5 years' time, the disease might not affect him that much because he's eating well, he's on medications as well. But if the other ignores taking the treatment, the latent stage will catch the other more faster than the one who's on medications and who's eating well and all.
So some of the things that can help, you said eating well.
Eating well.
What? Exercise?
Exercise is one, eating well, and then going to the hospital regularly. Because when you go, they put you on medications, antiretroviral medications. And these antiretroviral medications will reduce the speed or the rate at which the virus multiplies in the bloodstream. Yes.
Alright, so now let's talk about some of the causes. I know we've said some causes here and there, but I want us to go into the causes, like what actually causes HIV.
Okay. So basically, like we said, it's a viral disease condition. Okay. So most HIVs are caused by viruses. But there are means by which people can get this HIV. One of the means is, let's say, drug addicts. Yes. Some of them inject themselves. So if I inject myself and then I I pass the needle to a friend, and he also injects himself. If I'm infected, he will also get it. Some also get it in the hospital, like nurses and doctors when they are working. Sometimes you might have injected an infected person, and then in the process of cocking the needle, mistakenly you might injure yourself. It's also another means by which people get it. And then now people also get it from barbering shops and salons. Yes. If let's say you go to a barbering shop and a single machine has been used for a lot of people, let's say somebody comes and has a cut and it's used, and another person also gets a cut. Usually it's when there's an open skin cut, the avenue by which the virus enters is very fast. And then let's say if somebody is a mother, a pregnant woman, can also pass the sickness through the placenta to the child. But advantageously is that now all the women who go through antenatals, they are screened for HIVs. So once you are screened and you are positive, they put you on the medications before you deliver. So somebody can get it through pregnancy. Somebody can also get it after delivery. Let's say breastfeeding the baby. The breast milk might contain the virus. The child might pick the virus from the breast milk. And sometimes through childbirth, like delivery, through surgeries and deliveries where protective wears are not used. Let's say the baby's head was coming out, and then the midwife probably didn't have gloves or any other protective, might use the hand raw. Understand? Yes, it's a possibility.
But the hand raw, there's no cut.
Yes, there's no but he might come in contact with fluids.
Okay.
Like body fluids, let's say blood or vaginal fluids from the mother. It might be carried on to the baby mistakenly. It's possible.
Okay, but what about the midwife? Can
the midwife too can be infected? It's possible. Yes.
So now talking about body fluids, does it mean even wearing condom cannot prevent HIV?
It depends. Wearing condom reduces the rate at which you get the HIV. Yes, but there are condoms that can tear, or there are condoms that can burst along the line. Yes. So condom is one of the means that helps people prevents people from getting HIV. Yes.
But it's not safe. I feel safe.
It's safe, provided the condom is a very good one. If it's not, and it gets burst, definitely the semen or the sperm might also contain the virus, which can be passed on into the female person or whatever.
So now the reason I'm asking this is you said body fluids. So now body fluids, vaginal fluids, that is even apart from the blood contaminations and all that. So you said vaginal fluids, that saliva is also part.
It's also part. But
and then
sweat and saliva, there's a debate on it. Some school of thought are saying that it's not likely sweat and then these body fluids, let's say saliva, can affect somebody. But we can't tell. Okay, we can't tell. Once it's a fluid that is coming from the body system, it's possible a virus can stay in. Then once it's transferred to the body system. Now, the other way is somebody was also saying that it's not possible kissing can also cause HIV. But let's say somebody has a cut in the mouth, okay, and somebody kisses the person. The mouth has mucous membranes. There are membranes that are very soft mucous membranes that produce a lot of saliva and the rest of the mouth. So once there's a cut, automatically it can pass through.
No,
but if there is no cut, okay, it's not likely the person can get it.
Yes. So it means, basically, are we all at risk then?
Yes, we are. Because you might have sex with somebody who might not even tell you he has the virus. Yes, the person might be having it. You might have not gone to test. Okay. But once you come in contact with the person, it's likely.
Where I get scared is from the barbering shops.
Yes.
That is quite scary. Because at first, I think 2012, 2008, it was banned that blade shouldn't. Those times we were using blade twice, three times. Yes. It was banned. They shouldn't use blade twice and all that. But now that we are on the the machines,
Yeah.
and still there's an issue with that,
Yes.
which means whenever we are going to barber, we have to get our own machine.
Yes. For safety reasons.
Okay, so essentially, like briefly, how did this all how did it all start? Was it synthesized in the lab? Was it
Okay,
how did it start?
so I think the little history was somewhere in Congo. Yes. And is a Scandinavian man visited Congo. I think he went there for research. And he went into the forest. And, I think there were some monkeys and chimpanzees and stuff. So I think he had contacts with them. So he harbored it and then he transferred it. When he came among the human race, he was able to transfer that from the chimpanzees to the human race. Yes. So that's how come it started.
Okay, so it was actually in monkeys.
Yes, it was actually in monkeys.
Okay, so like it's a monkey disease already.
Yes.
And
So
they
they had it.
They had it.
Yeah. So most of these white people they touch these animals, like want to take their samples and all those things. So in an attempt of doing that, curiosity, yes, then we got it.
So if that was it, does it mean now when we also touch any monkey, can we?
It depends. It depends. It's not 100% though. Yes, but before you can be very sure of somebody having this HIV, you are supposed to take a sample and check. If you take a sample and it's positive, the virus is positive, it's automatically. It's likely you might get contact with it.
Alright. So getting to the management side, how do you manage HIV?
So basically, you manage HIV from awareness. Okay. If somebody is suspecting, usually it starts with some symptoms. Yes. Diarrhea, sore throat. Sometimes you have swelling on your lymph nodes, like the neck, the groin. Those areas become swollen.
These are the preliminary stages.
Preliminary stages, yes. Sore throat, you swallow, you take painkillers, you take antibiotics, and you realize still the pain is still there. And then some of them also lose weight a lot. Some also have fever. You take painkillers, you take antibiotics, the fevers are still there. So when you have all these symptoms in place over a longer period of time and they still persist, you're supposed to go to the hospital. Okay, let me go and check and see if you have gotten some of those HIV conditions. Yes. So going to the hospital is one of the main reasons. And then sometimes too, when you know that you are infected, you are supposed to tell your partner that I have this infection so that it doesn't become cross infection. Or if your partner comes and has sex with you, he probably goes to have sex with another person, it spreads. So once you tell the person, sometimes it's very difficult because we feel stigmatization and all those things. Why should I tell him? Go and tell this person. But it's the best because if you tell the person might not even come in contact with you.
That's stigmatization.
Yes.
That's essentially stigmatization. That's what all of us are trying to prevent, right?
Yes, but it's better to make the person aware so that the spread doesn't become that much. And then also during delivery, okay, most mothers are also put on the medications as well. So, and then if a baby is also exposed, the baby also has to be covered on the medications so that because ideally the baby might breastfeed. So once the baby breastfeeds, you might pick it. So once the baby is covered on the medications and even breastfeed, there are babies like that. They're on the medications and they're breastfeeding normally and they are no problem. And then those drug addicts too, we share these needles and the rest. It would be better if they stop that act. I think it will be very much. And then if people can also get their own machines when they go to rubbish shops, I think it will. And then there's one thing to circumcision. Okay. Yes. Okay. Children who are
circumcision, piercing, tattooing, those ones.
Yes. Yes, they are all means that people can get because they are basically using instruments.
Yes. Because last time we did a shoot in tattoo, a documentary, stuff of that sort. and it's the same tool, the
Yes.
same needle they use to
Yes.
do all these things. So I was actually wondering, does it also like when they finish, they put it in a sterilization box,
Yes.
but I don't know how effective that is. Is that box actually very effective?
It depends. Some are effective, some are not effective. Yes. Now, when they put it there, the full radiation,
Radiations will kill them.
it depends. What about if the box is faulty? You understand? That's why. Or somebody else might also come. The best thing is usually when you use the instrument, you're supposed to sterilize them. Okay. Put them in chlorine solution over a period of time. Then you wash them and sterilize them. That's the best.
So if I want to get tattoo, if I want to circumcise my 8-year-old child, what should I do?
Okay, so basically you are supposed to take the child to a hospital. And then the instruments that are going to be used should be sterile. Yes, it should be sterile.
But these are precautions that are taken by you, the health professionals.
Yes.
So it's actually not possible we can get it through that side. Like when we visit the proper.
When you visit a proper place where it has been sterilized, normally when you sterilize them, you fold them they are not air exposed and all those things. So when they are being used, you remove them from the wrappers and all that before they are used. So it's not likely to be infected because it has gone through various stages before it's being run. But there are some that are exposed. Like when you go, they are just lying somewhere and then they are being used. Those one automatically will tell you that these are just things from sterile. That is it.
So now, before we conclude, let's talk about facts and figures around Central Region or where we are now, Kaswa here. Is it fast spreading or is now becoming reduced? Because for some time, I think was it 2012, 2010, the awareness was quite big. Almost everywhere, love life, stop AIDS, love life. That kind of campaign was quite problem. But it seems for the past 5 years, 10 years, nobody talks about HIV. So most of us think that it's actually reduced or it's actually non-existent in the system at all. Is that the fact? Is that the case?
Okay. I think from experience, I haven't been getting more cases like previously. Okay. I'm sure the awareness is really helping. Yes. And then the education on TVs and the rest is also helping. I think some time ago in the program, the refugees used to be a lot. Because most of them left and went. It looks like it's gone down a bit. And then there was a time where they were taking the awareness to their houses and the rest. They group them, educate them, and the rest. So it's really helping. And most of them also know that once they get it, the centers are around. So they can visit the centers, then they can put them on the medications and all. And when you put them on the medication, you don't just leave them, you follow up. Sometimes you have to go to their houses, see how they are taking their medications and all those things. So I think it's reducing. It's reducing. Yes, it's reduced compared to previous. Yes.
All right. So there's hope for someone who has HIV.
Yes.
There's hope for someone who has HIV. What is it?
Okay. So the hope is a lot of people who've gotten it, and then the medications. Usually, when medications are there, medications help. There was something I forgot to mention. It's called CD4. CD4 count. So normally when you do your CD4 count is supposed to be like 500. The normal is 500, 1,500.
That is when you have HIV.
Yes, when you have the HIV. Okay. The AIDS.
Okay, the AIDS.
The AIDS is the advanced form of HIV. So usually when your CD4 count is less than 200. Then it means that the disease is killing you more than when your CD4 is high. When your CD4 is 500, the normal range is 500 to 1,500. When you are within that CD4 range, it means that you are getting better. So there are people who have CD4 count of 200, and once they are on the antiviral medications, the CD4 count has really shortened up to about like 500, 350, 400. It means that they are doing progress. Yes.
So, Doc, if you can break the CD4 down to like a normal layman, what the CD4, what does it mean?
Okay, so the CD4 checks your viral load. Okay. Normally when you get the virus, the CD4 count, or we check your viral load. Viral load is we're trying to know how much virus is in your blood. 1,000, 2,000, 10,000. So when you are put on the antiviral medications, because let's say a patient comes and the patient has a viral load of 4,000 or 50,000, and you put a patient on antiviral medication and it drops to from maybe 50,000 to about 10,000. We've done a lot of progress because the CD4 count has been able to reduce. Okay. So it means that you have been able to limit the amount of virus that is in the bloodstream from 50,000 to about 10,000. Yes. So that means that you are really doing well.
HIV cannot be cured.
It cannot be cured, yes, because it's a chronic disease.
It's a chronic disease.
Yes. Okay. Yes.
So finally, this is your camera. If you are supposed to advise the youth, what do you have to say?
Okay. So I'll tell the youth that they should use condoms. Okay. Yes. When they are having sex. And then when they see these symptoms that I'm talking about, this diarrhea, sore throat, weight loss, and all this, you should rush to the hospital.
So for clarification, persistent, the word should be persistent.
Yes.
Persistent diarrhea.
Yes. Over a longer time, 6 months, you are still showing all those symptoms.
So someone can have diarrhea for 6 months.
Yes. After taking medications and you still see that there is no improvement, yes, you need to go to the hospital for them to do further tests.
Weight loss, persistent weight loss, and they said rashes around your neck.
Yes. Yes. So the lymph nodes are swollen, yes, fever, weakness, muscle weakness, and all those things.
So that's the advice?
Yes, and then that usually the hospital is a friendly environment. People feel that normally when they get it and they go to the hospital, the nurses and doctors will be shouting at them. So, just feel free, come to the hospital, share your problems. Then if there's any need or any problem that you need to go, of course, we'll help you. Yes. And then those who also go to the barbering shop, yes, they should also try and then get their own machines if possible, so that it doesn't also put you at risk of getting the disease condition. Yes.
Wow.
So basically, that's advice.
So you are saying we should get our papers when we go to the barbering?
Yes.
Oh, all right. Dr. Ben, I am very grateful for such an in-depth understanding about these things. Today I've heard words like lymph nodes, CD4. These are 5 heavy and good words for my audience. We actually thank you for your time. And so, people, we are in Co Clinic, and Co Clinic has your back. We have everything here. From normal disease, gynecology, dentistry, anything that you want, it's called clinic. This episode that we will be shooting here, and it's going to be sponsored by Co Clinic. So Co Clinic is located around Kaswa, that is Budumbram, Budumbram area. So come if you want to get your test on HIVs, anything you want to test, everything is here. And you can also reach out for Dr. Ben. We will put his contact in the video where you can get one-on-one sessions with him. And I think it will be very good. So, as I said, this is sponsored by Co Clinic, and we have you at heart. Please share the video and let's reduce the cause and effect of HIV in our system. I remain Kwesi Aban, and I will see you next week. Thank you.